Hi, I'm Joe Feeks, editor of Pig Health Today, and with me is Dr. Aaron Lauer. He's a swine veterinarian with the Carthage Veterinary Clinic in Illinois. Aaron, welcome back.
Yeah, thanks
Nice
for
to
having
have
me again.
Aaron, for as long as I can remember, the menu of diseases in the pork industry has been a veritable alphabet soup. I mean, years ago we had HPP, APP, PRV. Years later, PRRS, PCV. The list goes on and on.
Yeah.
Now we have another one, and it's PPIV1,
Yes.
otherwise known as Porcine Parainfluenza Virus 1. What's the story with this bug?
Well, Joe, the continued spread or identification of pathogens really is a credit to our diagnostic labs and the universities, because really some of these viruses have been circulating around in pigs a long time. We just have the technology now to go out and identify them. Some of them, unfortunately, have also been new introductions into the U.S., but we believe that this PPIV, or Porcine Parainfluenza Virus type 1, is probably one that has been chronically infected in the U.S. herd and probably relatively ubiquitous, and that most of the herds are probably infected.
So I understand it was first identified in Hong Kong in 2013.
Yeah, so the first time it was associated with pigs and respiratory infections was in Hong Kong. They had a study there where they took samples from pigs at slaughter and ran all sorts of testing and identified it there on swabs. There had been some initial work earlier than that in some small neurologic cases in pigs in the U.S. where they had identified a type 3 in the brain of pigs, but we don't really believe that that's probably a normal clinical expression of this virus.
While it was first identified in Hong Kong, you're not approaching this as a foreign animal disease. You think that this is something that's been in the U.S. herd for quite some time.
We believe so. It was just typically when we send in, what we've been seeing clinically would be that pigs will have a bit of sneeze and cough prior to weaning, and unfortunately that's relatively common in a lot of farms. Generally you'll test for influenza. If they're positive, you got your answer. If they're negative, we just kind of would write it off and say, well, maybe it's Bordetella or maybe it's Pasteurella, but a bacterial driver. There's been a number of cases where pigs are relatively sick pre or post wean, and we can't find that. But then on the histopathology, which is where they're looking at the cell population in a case, it would have lesions that were suggestive of influenza. And so that's really kind of what triggered us to say, hey, I really think that there's a virus there, but I'm not sure. It's not influenza, but I'm not sure what virus it is.
Well, and let's sort that out, because when you hear influenza, parainfluenza, to the uneducated ear, it sounds like we're talking about the same thing, but we're not?
We're not. Obviously, with a name like parainfluenza, they named it that because of it really mimics influenza, but really to a much more mild degree than that. So parainfluenza it's in a family called paramyxoviruses and resboviruses, but it's in a total different virus class or family than influenza, but clinically acts the same, hence the name.
And I understand Kansas State University took a hard look at this disease.
Yeah, Kansas published a paper here last year to kind of look at what's the seroprevalence within the swine population and PCR positive samples. So on their cross-sectional sampling, they only found about 6% of the samples that had come in PCR positive for it. But that's probably skewed a bit because the virus really likes the upper respiratory tract, being in the nose or the nasal turbinates, as well as in the trachea. So on those samples that were lung tissue, generally you're going to get negative even in positive pigs. So the preferred sample type is really nasal swabs or upper respiratory tissues.
Are there certain types of pig operations that might be more susceptible to this virus?
It seems like it's relatively ubiquitous in that even in farms that have got clinical signs and ones that don't, they generally will find the virus. And so we're struggling then with the question on whether is it a true pathogen or not. And the holdup in that is that we've got to be able to take that virus and culture it in some cell culture and then try and infect some pigs to see whether it causes clinical disease. And that's where the industry has gotten hung up, is that we haven't really put a lot of time and effort into trying to get it cultured, and the initial kind of results haven't been that effective. So once we can get the virus cultured, we can put it into pigs and fulfill Koch's postulates to say, yes, this is a true pathogen or not. The difference in herds that have got it and herds that both have it, but whether it's clinical or not, we're not sure on. So is it a true pathogen? is there co-infection that's required in order to make it clinical? In the cattle world, they would say that usually that virus has to have a co-infection in order to make it clinical. Or the third would be, is there a lot of strain variation? So in some herds that have got it but not clinical, is that a more mild strain versus maybe a more pathogenic strain? So a number of questions that we've got to answer before we really understand it.
And are you seeing it in a particular age of pigs?
Yeah, generally we'll see clinically at say 15, 16, 17 days of age, you'll start to see some sneeze, cough, and those pigs will clinically have it. And then also in the immediate post-weaning period, you'll hear that same, the cough seems to kind of go away, but the real issue with it is these pigs are really slow starters. They're depressed, they don't want to eat, and so the first 7 days or so after you wean them, the caregivers report, I'm having to pull out of pigs, do a lot of treatments. The pigs will generally get started and go, but without much mortality, but it's just a lot of work.
But the symptoms you describe, I mean, that could be almost anything.
It could be, yeah. And so that's where we're struggling with this virus in particular is in those cases, in these situations, we continue to send diagnostics in, and the only thing we continue to come up with is parainfluenza. But you'll get some bacteria, or if you might get influenza, and in those cases, we'd say, well, that's probably the primary driver.
What sort of tools do you have right now for treating and/or protecting animals against this disease?
The treatments with antibiotics haven't really been that fruitful with regard to...
It's a virus, so...
Yeah, it's a virus, and even controlling the secondary bacteria, so that doesn't seem to be a big driver. We're generally using quite a few anti-inflammatories, aspirin or NSAIDs, in order to try and just make those pigs feel better, try and get them to eat. With regard to, say, a vaccine intervention, because we haven't been able to grow the virus yet, there hasn't been a lot of work on the vaccine side.
Have you seen any common denominators in infected herds in terms of co-infections or housing?
Yeah, not really. So with like the herds I work with, I've got multiple herds that are positive, but I would have 3 farms that clinically have it all the time, and the pigs are really slow starters, etc. And so I don't think that this virus in itself is a widespread huge industry problem per se, but it does seem to be an issue in some of those farms. But those farms are generally healthy, PRRS negative. We've eradicated flu out of them, and so it's been difficult to say, yeah, why does this farm have it worse than those? And as we compare sequences, we're trying to understand, is it just a strain variation or what is it?
It's never a dull moment in the world of a swine veterinarian, is it?
Yeah, I think our producers keep rolling their eyes saying, well, what's the new bug of the year? So, but I think this is a relatively mild pathogen, and maybe even more of one to understand why I've got the clinical syndrome, but maybe we do or don't have an intervention for it, because at the end of the day, it's relatively low mortality, just kind of a headache virus.
But it's something that producers need to keep watch for, and if they see their young pigs slowing down, they should certainly contact the veterinarian.